This is a video showing an upper right central incisor implant being placed. The patient has been sedated, hence they have the mouth prop on the left hand side. Otherwise, nearly all of our implants are done under local anaesthetic. They've had plenty of local anaesthetic prior to this point, which we didn't think was necessary to show. And this just shows the very simple and very minimal incision line.
Well done.
What we do is pull the gingival tissues back slightly just to give good visibility below, whilst not preparing too big a flap, and this reduces the amount of swelling that is going to occur post-surgery. We've certainly found the smaller the flap and the less invasive the surgery, the less swelling patients get afterwards. We're just continuing to make sure I have good visibility at this stage, ready to start the drilling process. This is the pilot drill, which gives the eventual position for the implant, and it rotates fairly slowly, around about 1100 RPM. And you can see we irrigate with a small amount of saline. This is a very important aspect to get a very precise position, as this will tend to govern the final position of the implant. In the buccal palatal position, but more importantly for the type of restoration we carry out here at the implant centre, to make sure this is going to be a screw retained crown. You can see we move backwards and forwards to keep things well irrigated. I'm going to take the drill out just to check my alignment. We then change over the drill to the next size, which is a countersink drill. It just follows the same path as the pilot drill, flattening off the bone and making the next drill very much easier to use. This final tri-spade drill is all that's required for the ankylosing system, and again rotates relatively slowly and will follow the pilot hole down to the full depth. Again, you can see us removing and replacing the drill to make sure it's well irrigated and that the bone is removed. This is called the reamer burr and finalises the shape and size of the implant position, and just rotates at 50 RPM. That's the implant position completed. And it's now ready for washing through, and this is the intravenous formation of metronidazole, just used to irrigate the area and make sure that any bacteria that may have worked its way into this region through the saliva can hopefully be killed off. We then hold the soft tissues out of the way and the implant is placed without touching anything down to the final depth with a motor. This is again placed at very slow RPM and without excess torque. The final position is obtained with a small ratchet device, and you'll be able to see the level of torque that can be gained with this implant system. The implant is placed a few millimetres below the level of the bone. And the small metal carrier, which is just aimed to hold the implant, is unscrewed. There's a very small bit of drilling at this stage just to remove any bony prominences that may interfere with the sulcus former, which is placed on top of the implant, so allowing transmucosal healing, and this means that the patient doesn't have to have any further surgery. The vast majority of the implants that we place have this metal healing cap positioned at this first stage of surgery. We now assess the need for any bone augmentation, and as there is a slight defect over the crestal aspect of this implant, a very small volume of bone is added. We wash through again with some antibiotic solution, metronidazole. Prior to the bone graft being placed, we adjust the soft tissues slightly to allow the gum to fall back into position slightly more easily. And this soft tissue can actually be utilised on the mesial aspect of this implant to gain some soft tissue in this region. Just assessing here to see if we're going to do the same on the buccal surface, but this wasn't necessary. Again, maintaining as much thick soft tissue as possible.
When the video camera's going to accentuate any shaking.
This is a simple bone graft material that is placed just around the buccal surface of the implant, and the soft tissue allowed to close over the top. As the periosteum is intact, we haven't needed to use any membrane in this case. The rest of this video now simply shows a few stitches being placed to hold the soft tissues in as ideal a position as possible, prior to this patient having an adhesive bridge attached to the other central incisor to allow for soft tissue and bone to implant healing. You can see that the patient in this sedated case is held open with a mouth prop, but patients who are treated under local anaesthetic, we maintain as carefully as possible saliva control by not letting the patient close during the what will be a maximum of 9 or 10 minutes of surgery.
Pull through. It's fun, isn't it? Suddenly thinking about what you're doing.
Yeah.
Changes it. Perfect. One more stitching afterwards. I'm just going to offer up the adhesive bridge so you can see it for the video.
That concludes the surgical aspect for this patient's treatment. She will then have a check in a week's time to make sure everything is healing nicely. prior to, in 6 weeks' time, having the impressions taken for the implant crown, which would usually be fitted just 2 weeks later. You can see how simple the surgical aspect is in this case, and that is true for nearly all of the cases that we treat. This whole process taking only about 10 minutes, and that was probably a little slowed due to the extra time taken for video being taken.